Hi, I'm Emma Halliday, and on behalf of our theme lead, Catherine Walsh, I'd like to introduce you to the Equitable Place-Based Health and Care theme meeting. I'll start the session by briefly introducing the theme in case you've not been to one of our meetings before, and then just provide a short update on development since our last meeting in April. The Equitable Place-Based Health and Care theme has a research focus on supporting place-based approaches to addressing inequalities in health. And we have a particular focus on looking at how we can work with local systems so they become more responsive to the local needs of people's communities and places. Our focus is both on social determinants of health, so the conditions where people grow old, live and are born. And also we have an interest in an integrated approach to delivering services or meeting needs in a local place. If you'd like some more information about the theme's work, you can have a look at the ARC website. I think the link will have been posted in the main chat, I'd imagine. But also, of course, please feel free to post questions and comments in the chat as well. So before we move on to the main part of the session, I'd briefly like to update on some of our ongoing and developing projects and activities since we last met. Firstly, our air quality and health work continues to progress. The ARC held an air quality and knowledge exchange workshop last week, and that involved presentations from public advisors and 3 ARC themes from EPIC, the Care and Health Informatics theme, and also Improving Public Health, and also colleagues in ARCFEST in a different part of the country. It also engaged with the NHS, the City Council, and also a social enterprise called Regeneris. I think presentations which will soon be available on the ARC website, and conversations are also taking place about other outputs and next steps. Secondly, work on the voluntary community faith and social enterprise sector was presented on at the last meeting. And at that session, we talked about how a new alliance is attempting to improve partnership working between the EPHC and statutory sectors in Lancashire and South Cumbria. This phase of the research has concluded, but over the summer, EPIC is now working with the impact team to identify options for future evaluations of integrated care, which involve the BCFSE sector. And then finally, under ongoing projects on the slide, the COREN, or Community Research Engagement Network, has really gathered momentum. Since the ARCFEST in April, we've appointed 2 public advisors, and Annie Edwards has also been organising our first events to discuss the priorities for the future, and also a coordination group is now set up to work on delivering those priorities. We also have a couple of new projects which have got going as well. Firstly, you may have heard Paula Wheeler talking about the United Together project in the introductory sessions, and that's a project where we're working closely with Active Lancashire on an initiative to improve the health and well-being of former offenders in community settings. And we also have newly developing research on the Balerig Garden Village development, which is part of the Ministry for Housing, Community and Local Government's Garden Communities Initiative. And you'll be hearing a bit more about that later in the session. Just quickly, I'll flag up a couple of publication highlights since in the last couple of months. Firstly, on social prescribing in the Journal of Public Health, we have a journal article published, and also an ARC Bite, which is on the project website for the EPIC theme, which is the research on the BCFSE research I've just described. So moving on to the remainder of the session, we're going to have a couple more updates from ongoing research, and we're really pleased to be hearing from 2 of our PhD students connected to the theme. Then Fiona Ward will be talking about some new diary findings from our lockdown diaries. And finally, we'll conclude the updates and presentations with an update around the Balerig Garden project, before I think we'll be having some opportunity for feedback and questions. So as I said, there'll be an opportunity to pick up questions at the end of the session, but please use the chat throughout the session to post questions and comments, and the team will be able to engage with you that way. And now I'm going to close my screen and hand over to Koza, who will be taking us through the research in EPIC focused on social prescribing and health inequalities.
Hello, my name's Kosa Khan. I'm one of the researchers that works for the Equitable Place-Based Health and Care theme, and today I'm going to provide an overview of the research we're undertaking on social prescribing and evidencing its impacts. So you might ask, why is this important and why are we actually focusing on social prescribing and its impacts? Well, as many of you will be aware, there's a considerable amount of social prescribing activity already taking place across the North West Coast. And what we know is that it's commissioned and delivered in a range of ways and through a range of sectors. But what is less well known is how the different models are being implemented and how they work in practice and what impacts they have. We know there is a growing evidence base that supports the benefits of social prescribing and the impacts it can have on individual lives. But at the same time, the literature also emphasises there's a lack of robust evidence that demonstrates impacts and outcomes of social prescribing. In particular, there seems to be limited evidence on the impacts of social prescribing and health inequalities. Many research studies and evaluation studies focus on the implementation of social prescribing and service user experiences, and there's less of a focus on how the service or intervention might be impacting health inequalities, whether that's positively or negatively. Through conversations with local stakeholders, we've also found that there's a considerable amount of social prescribing data that's already being collected. So this is data on social prescribing service users and the outcomes that they may experience. However, this data is not always being fully utilised to evidence impacts or demonstrate outcomes, in particular in relation to health inequalities. So this really provided us with the opportunity of, rather than trying to collect new information and on social prescribing, and how we might better use existing data, and can we actually apply a health equity lens to explore how social prescribing may be impacting health inequalities in the North West Coast. I'm now going to provide a brief overview of what our research objectives are and what we hope to achieve. Our objectives include testing the feasibility of accessing and analysing routinely collected data to demonstrate the reach and impact of social prescribing interventions on health inequalities. And when we refer to routinely collected data, this isn't just referring to NHS data, but also data that's held by organisations such as the local authority and third sector community organisations that are delivering social prescribing services. Also hope to identify any gaps in data collection and potential opportunities to improve data collection processes and how data is collected to demonstrate impacts for social prescribing. We hope to explore how different models are being implemented and how these models influence outcomes, in particular in relation to health inequalities. More importantly, we're hoping to produce learning that will support the social prescribing commissioning and service delivery, particularly the findings from the earlier objectives and the data and what this tells us about the social prescribing services that are being delivered. And this would also influence and support the future research plans that we may have and how we evidence the impacts of social prescribing interventions. And just to mention, this is a small scale project that currently involves 2 areas, and we hope to expand on this as the research develops and as there's potential to explore research questions that are important to our stakeholders. The research will take place in 2 demonstration sites in Pennine, Lancashire. And this involves working with 2 social prescribing service providers. The first one is based within Blackburn with Darwin Borough Council and is commissioned by the local primary care, which is a GP consortium, and the link workers are actually employed by the local authority. The second service is delivered through Burnley, Pendle and Rossendale CVS and is commissioned by East Lancashire Clinical Commissioning Group, and is more of an established service. They've been delivering social prescribing for a number of years, whereas the social prescribing service in Blackburn is relatively new and had started prior to the pandemic last year. We're also working with a range of stakeholders, and this includes those people that are involved in clinical commissioning roles for social prescribing, service delivery, as well as monitoring and evaluation of social prescribing. We also have 2 public advisors that are part of the research team that will be supporting the conduct of the research. And finally, we're working with the Improving Population Health theme and collaborating on this piece of work. And their researcher will be supporting us with the quantitative data analysis and how we present the findings from that aspect of the research. Ethical approval for the study was granted last month by Lancaster University Ethics Committee. Now, there was a bit of toing and froing here, but we did get there in the end. The research itself will be conducted in 2 phases. The first phase, which is currently underway, involves us accessing the social prescribing data. So this is service user data that the 2 social prescribing services collect through their case management systems on the individuals that access their services, as well as a sample of service user case studies, which are already collected as part of their internal feedback processes. Conversations are also underway with key stakeholders to inform the data analysis and to ensure that it's meaningful and reflects any local priorities. The data analysis will focus on who is accessing the service, how people access the services, and any outcomes. And we hope to include demographic profiles of the local area and match that against demographic profiles of those that are accessing the services, and really looking for any variation in reach and outcomes across those demographic profiles, but where possible also picking out any other individual level data, such as different health conditions, and do people have different experiences or different outcomes as a result of any of these factors. Phase 2 of the research will then involve us taking the findings from the first phase and having conversations again with key stakeholders, link workers and service users to explore what the data is telling us and what might be contributing to the variations in the data that we might find, but also identifying any data gaps and any factors around how we measure outcomes for social prescribing. We also plan to conduct 10 interviews with individuals who have disengaged with the services, again to understand what barriers may be experienced by these individuals and if any inequalities are coming into play. Finally, before I finish, I thought it'd be useful to touch on some of the capacity building elements of this project and the collaborations that have arisen on social prescribing research. So one of the things that we are particularly focused on is how can we better utilise existing data. And as I mentioned earlier, there's a considerable amount of information collected by organisations on the services they deliver and the people that access these services. So it's around how do we support organisations to think about how they use data and how they use this beyond performance management and reporting to actually demonstrate the impacts of social prescribing, but also to think about this more broadly around the impacts on health inequalities and how can we actually demonstrate such impacts. So one of the things that we are hoping is that the framework we apply for the analysis in this project is something that could be used by the organisations and developed and to be applied to the data they collect on other services and projects they're delivering, to explore how those services or projects might be impacting health inequalities. In one of the research sites, we've had discussions on how the project can support their data apprenticeship scheme by providing a practical project for them to get involved in and for the apprentice to develop their skills, as well as providing an opportunity for the apprentice to work with experienced researchers, in particular the researcher based within the Improving Population Health theme who will be conducting the data analysis. Moving on to the collaborations now. Through Lancaster University and its partnership with the Nova Lisbon universities, we've had the opportunity to share our research plans with their School of Public Health researchers. They also plan to conduct an evaluation of a social prescribing service in Lisbon, but hadn't specifically considered health inequalities. So we'll be now working with them and sharing our data analysis framework and research questions, which they will plan and apply in their evaluation. This will also provide us with some comparative international data as well. We will also be presenting at a joint international workshop with the School of Public Health on social prescribing in November to share our findings. We've also been involved in submitting a bid to the National Link Worker Evaluation Call with the wider ARC Social Prescribing Network, working with the ARC researchers as well as researchers from the ARC Kent, Surrey and Sussex. The theme is a co-applicant, and if successful will lead on the evaluation framework. The evaluation also includes the focus on routinely collected data and health inequalities, which will also help build on the work we're doing on the projects I've spoken about today. Finally, we've been involved in the NHS England Improvement Pilot that aims to develop a minimum data set for social prescribing to help provide more consistent data on social prescribing. And the next phase of this work will be also focusing on outcome measures used to record impact. So this was a brief oversight into the work we're doing. And if anyone would like any further information, please do contact me and I'd be more than happy to speak to you. My email address is here, which is k.cornfor@lancaster.ac.uk. Please also use the chat option to post any comments and questions you may have. And thank you very much for your time.
Thanks, Koza. We're really pleased now to hear the insights from 2 PhD students connected to EPIC. I think firstly a short video from Suze Gibbon, followed by a presentation by Lucy Caluvo. I hope I'm pronouncing your name correctly, but please correct me if I'm wrong, Lucy. So could we have the first video, please?
This research will look at how engaging with green and blue space affects or results in social inclusion or feelings of belonging to community for people with mental health problems. Please look at the image on the screen and just take a moment, take a deep breath and relax. You've probably seen in the news that because of COVID, people have been reassessing their relationship with nature. We feel closer to nature as a result, and the more of us are using public green spaces, it is helping us to kind of get through. Even just looking at images like this is good for us. Here are simple definitions of green and blue space before we go on, just for information. But we really do have a natural health service out there on our doorstep or nearby. The North West case is especially lucky to have incredible landscape all around. It is available free of charge, doesn't usually require equipment, and anyone of any age, background or ability should be able to access it. This is reinforced by research which has bloomed over the last few years. Green and blue spaces are good for physical and mental health and well-being, be it through the opportunity for physical activity, reduced pollution, stress reduction or restoration. There are obvious benefits to sustainability in the environment, and increased interest in community gardens, allotments and park friending schemes and the like enhances this. Interestingly, green and blue spaces are also good for our communities and social inclusion, helping to build social connections and a sense of community through bringing people together, offering a place to get together, get involved and volunteer, or just spend time with other people. Mental health problems are the biggest single cause of disability in the UK. We seem to be more aware of mental health issues than ever before, including, of course, more recently, the impact of pandemics on people's mental health. Ironically, however, people with diagnosed mental health problems continue to report not feeling fully included in the communities in which they live. People with mental health problems are amongst the most socially excluded. This can result in a range of negative outcomes, for example, poor access to services, high unemployment, increased rates of homelessness or insecure housing. These factors are all known inequalities of health and translate into premature mortality and a high prevalence of physical health conditions such as COPD, diabetes and obesity. On the other hand, social inclusion is associated with better outcomes for people with mental health problems, resulting in improved general well-being, decreased loneliness and better quality of life. It also helps in breaking stereotypes, reducing stigmatisation, and social inclusion for people with mental health problems is beneficial on the community as well as an individual level, reducing expenditure on services, for example. Much of the existing research looks at the health and wellbeing benefits to the general population. The research largely ignores the voices of people with lived experience of mental health problems. I won't focus on green or blue social prescribing here, but there are services such as care farms and walking groups that deliver specialist support to people with mental health problems. There is also growing availability of community gardens and allotments, often which intend to promote general population wellbeing through a connection with community and nature, or just to grow food and promote social cohesion. However, simply being in nature may be experienced by some disabled people as stressful and indeed may be impossible for some. This research is developed from my personal experience. My own strong attachment with nature has been impacted by mental health problems, and anecdotally I'm not alone. Reasons that deter people from engaging with nature may include not feeling accepted, embarrassment, fear of negative reactions. Stemming from this, safety is a significant issue. Also, symptoms or medication side effects such as tiredness, fear or paranoia and physically feeling ill can impact people's ability to get outdoors. a catch-22 situation arises where someone with mental health problems who could potentially benefit from engaging with green and blue space and may even be referred to a project or service is unable to participate. Disabled people, including those with mental health problems, are one of the groups least likely to use outdoor public spaces. This in turn may mean people are more socially isolated and perpetuates poor health. In the face of such barriers, how then do people with mental health problems access the benefits from engaging with green and blue space to feel more included in their communities? Participatory research is crucial, ensuring it is grounded in the perspectives and experiences of the group that are the very focus of the research. It transfers power to participants who become active agents with expert knowledge rather than simply casting people as service user. It is more sensitive to the needs of participants and more likely to be accepted as valid. In the first phase, I will undertake a literature review. At the same time, I will recruit and train participant co-researchers drawn from the various social farms, community gardens and volunteer organisations who have shown interest and enthusiasm for being involved during background scoping research. Furthermore, I have 2 ARC public advisors linked to the study who will provide expert insight. A series of 3 to 4 focus group discussions facilitated by the co-researchers and myself will explore the issues identified in the literature review from the group's experiences and perspectives. Understanding through people's lived experience is critical and has so far rarely been explored. The second phase of the study will be developed with a user group of co-researchers building on learning from phase 1. We will decide on the most appropriate methods for exploring the themes and aims with a wider population of people with mental health problems. With a predicted mental health crisis following the COVID pandemic and people reportedly feeling a closer connection with nature and their community, this seems the perfect time to examine the relationships between green and blue space, mental health and community belonging. If you'd like to get in touch for more information or to get involved, please email me at sgibson10@uclan.ac.uk. Thank you for listening.
Great. So if you have any questions for Suze, please post in the chat or email her directly. And Lucy, can I invite you to share your screen?
Thank you. Thank you very much. My name is Lucy Kaluvu. I am an ARC NWC PhD student at Edge Hill University, and I'm with the Faculty of Health, Social Care and Medicine. For my PhD project, I'll be looking at multimorbidity, which is a very important public health challenge. And I'll be looking at the aspect of clustering. And clustering really refers to the grouping of conditions, and it's an aspect of multimorbidity that is very important. And also I'll be looking at 2 important healthcare outcomes, and this is the utilization of health and social care services and treatment burden. What is multimorbidity and why is it an important public health problem? You find that it's not just a problem for the United Kingdom, it's a global health problem. And you find that when 2 or more long-term conditions coexist within an individual, this can really bring challenges to how they live their life, how they're able to interact in terms of their social environment, and also in terms of how they really carry out their life. And you find that multimorbidity is a really great problem in the United Kingdom. 2 in every 3 individuals actually have multimorbidity, particularly those who are older than 65 years. And you find that this really has become a challenge when we look at younger individuals who are below 45 years. And these are individuals who are developing multimorbidity 10 to 15 years earlier than their counterparts who live in more affluent areas. And you find that this makes us ask ourselves, is socioeconomic status really becoming a challenge with how we view multimorbidity? And you find also additional factors such as lifestyle behavioral factors like alcohol consumption, excessive smoking of tobacco, leading a very sedentary lifestyle, and also intaking high caloric diet really has made people develop obesity, which is becoming a risk factor. And you find that why is multimorbidity important? Why is it a challenge? You find that where we have high mortality rates from multimorbidity, and this is all cause and also from vascular mortality, we have a high burden of illness that is faced with patients, and also the burden of treatment that comes in. And that's why you find it's a challenge for the NHS, for policymakers, and also for researchers to understand how can we do this. And you find that there's a paradigm shift. We're no longer looking at the pathogenesis of multimorbidity, but we're also asking ourselves, what is the social and environmental construct that is influencing how we view multimorbidity, its treatment, and how it's affecting how patients utilize healthcare services and how really they behave towards accessing these services. When we look at the scope of the project, really, as I've talked about, there's really a paradigm shift, and it's very important to understand this is where the public health practitioner comes in, because we have to understand the social and environmental determinants. when we look at clustering, why is it important for us to group conditions or patients together? We find that for cardiometabolic clusters, really which are affecting individuals above the age of 85 years, we find that this age group really has type 2 diabetes and cardiovascular disease as the central diseases that are within these clusters. And you find that individuals who are between 45 and 65 years tend to develop conditions that have mixed clusters. And even because of exposure to alcohol consumption and also tobacco smoking and a sedentary lifestyle, you find that we are now also having clusters where there's alcohol dependency. And you find that the issue of pain, which is a somatic factor, is really coming in terms of clustering. And this really is an important thing to figure out. How is it that pain is becoming very central to these clusters, yet it's one of the issues that has not been looked over. So this is a very important thing to consider, because multimorbidity patients are the highest users of health and social care services. They face a lot of problems with, they're the highest users of GP referrals. They have challenges in accessing primary care. They usually have multiple regimes of treatment. So you find it's very important to understand when we cluster patients or disease conditions, how can we be able to target programs that will ensure that we are able to look at these patients as a specific group and target programs that can address this challenge? What is the current evidence? You find that a lot of studies have really looked at multimorbidity clustering. Some have looked at chronic disease as a unit of analysis. Others have looked at the patient as a unit of analysis, but there are really different challenges in the methodological approaches. You find some of the authors have utilized population-based studies, others have used surveys, others have used clinical research practice data. Others have used different settings. Some have done their studies in Scotland, others in England. And actually there's only one study that has assessed the trajectory changes in multimorbidity by Vetrano et al., which was a Swedish study. And you find that most studies have been centered really with a cross-sectional design as opposed to a longitudinal design. And this really begs the question, how are we going to examine how a chronology of multimorbidity occurs? Is it important to think about the order in which diseases are diagnosed? So that brings me to my objectives, and that's how I'm going to look at first, how is chronology affecting how multimorbidity clustering occurs? If I'm a patient who is aged 64 years and I develop cardiovascular disease and subsequently develop a mental health condition, how is my utilization of health and social care services different from another individual who develops anxiety before and ends up develop something different? So you find that for my methods, I'll be able to do a retrospective study, which will be looking at cross-sectional data analysis. And this really will use the shared care record, which is an important care record because it has both a linked health and social care data. And because social care utilization really is not explored very much in terms of multimorbidity, this is a unique opportunity to use this data set. And it's central to the northwest of England. You find that the northwest of England has incessantly poorer healthcare outcomes compared to the south. And this is in terms of a lower life expectancy and also high mortality rates. We'll also do a qualitative study, which will look at purposive sampling and semi-structured interviews. And our setting will be St. Helens, which is a socioeconomically disadvantaged local authority within the Cheshire and Merseyside region. And for collaborations within the project, we are going to look at the St. Helens Clinical Commissioning Group, the Knowsley NHS Trust, and the St. Helens Borough and the Contact Care Centres. Thank you for your attention. For any questions, this is my email address, 24885703@agiluniversity.ac.uk, or you can also follow me on Twitter at @elkaluvu, and I'll be able to answer your questions. Thank you so much.
Thank you, Lucy and Suze, for two excellent questions. Yeah, please comment, and I can see the chat sort of starting to have some questions posted there and some kind of reflections. So please feel free to add to that. We're going to now move to a focus on sharing research findings. People may have heard of the lockdown diaries, which public advisors and ARC were very closely involved with during the first lockdown in the pandemic. And Fiona's going to talk about some new analysis and findings which we've undertaken for this project, because the diaries really just had such a wealth of information. So Fiona, over to you.
Okay, thank you, Emma. Yes, as Emma says, you may have heard something about some of the diary findings from previous events, but I'd like to tell you a bit more about a paper we're currently writing. Before that, I'd just like to say something more generally about the diary project, just as a reminder. The diary project got up and running after during the first lockdown, and it aimed to test out this as the diary method to gather public insights and experiences of how COVID-19 was affecting local communities. And we used this method because traditional research methods weren't practical. So after getting ethical approval, we emailed all the ARC North West Coast public advisors, and 15 advisors started and all completed the diaries. We recognise the time and energy they put into doing this at this difficult time. So the diaries were completed from the 20th of April 2020 for 8 weeks. We didn't ask diarists to write about particular things. It was mostly free text for them to record as they chose about their daily activities and their reflections on their current situation. But in addition to the diaries, each week the diaries had a call with a nominated researcher where they asked about their general well-being and any standout events during the week. So we've shared the findings from the diary projects in quite a number of different ways to date. So just as examples here, we produced 4 research bites because we wanted to get some findings out early. We had seminars and ARCFEST events, so there was a forum where people could ask various questions. And then we submitted evidence to the Health Foundation's COVID impact inquiry, which was UK-wide, and it had a particular emphasis on people with health conditions and also on inequalities. So it was a good fit for the information we'd collected. And we know that public advisors have been sharing their experience of being involved. And just one example is one of the public advisor co-leads for the EPIC theme presented at an ARCEast workshop on inclusive research. Local radio, newspapers and digital media have taken an interest, and we were able to reach a wider audience through those means. And in terms of journal articles, one's been led by Emma on mental health and coping strategies. And I'd just like to tell you a bit more about one that's currently in production. Sorry, went a bit quickly there. The paper I've been leading on is on community responses to the COVID-19 lockdown. And we're using a framework developed by someone called Chaskin in 2001 to explore how community responses are described and observed in the diaries and how community capacity was built. And this is the definition of community capacity in the framework we're using. And as you'll see, it's about the interaction of resources that can be leveraged to solve collective problems and improve or maintain the well-being of a given community. And that was particularly important during the lockdown. The 3 elements of the framework that I'd like to focus on today are the conditioning influences or the context of the community capacity building, and I'll describe that in a minute, the levels of social agency and the outcomes of the community capacity that's built. But other elements are the characteristics of community capacity, strategies or ways of working, and the functions or intent of the capacity that's being built. So looking a bit more closely about the conditioning influences, the context of the lockdown was critical. So observations and experiences of the diaries showed that the lockdown both facilitated or enabled capacity building, but it also inhibited efforts to build it. And I've chosen a few quotations for each of these areas to describe some of the key features that resulted from the context. So this first quote is a diarist talking to one of the researchers in one of the weekly calls about a funeral procession in their street, saying it brought everybody out to pay their respects. But they also made the point that it's unusual for the place to be so busy during the day, and they felt it showed a sense of community spirit. So people were more likely to be at home or close to home, and because of the weather in this time when we were doing the diaries, it was good, so people were likely to be outside. And some diaries suggested there was greater connectivity, and for some a feeling of all being in it together. Although other diarists expressed frustration at the behaviour of some people who they didn't feel were sticking to the rules, so this being in it together had different dimensions. There was also people were more likely to be around and have time. So sorry, I'm not sure why the slides are moving on. Volunteering roles have been suspended. And some people said this led them to find other things to do to support people. So people had the capacity, and also businesses and other organisations were providing resources for food, for example, for distribution. But as some people were able to take part and undertake volunteering roles, people who were shielding were certainly more inhibited, restricted. And this quotation illustrates the perspective of somebody who would have liked to have been involved in the activities, but was unable to because she was shielding and was depending on other people to do things that she would have liked to have been doing. And this quotation expressed the frustration that she felt doing this. So the levels of social agency, another dimension of the framework, is to say whether the community capacity is being built through individual residents or through community networks or through organisations. And we found in the diaries that most frequently people were talking about capacity being built by individuals offering help to their neighbours, and sometimes through street level groups. As this person said, through a WhatsApp group, they were able to offer help to their local communities. One of the diarists was involved in a much more coordinated response with a network of individuals and organisations, including businesses. And this quote describes their activity on one particular day. So going over to the primary school to collect food, to package, and then to distribute. And this diarist makes the point that there was great demand for this service. So as people were dropping off the list because they'd managed to sort out other ways of accessing basic necessities, other people came onto the list. And sometimes it was a very long day for the people involved in these activities. Another diarist described how they got involved and were keen and eager when organisations, sometimes after a period of time, were able to set up systems, online systems and telephone systems where people could go back to their volunteering activities. But some volunteers felt there was a disconnect between what they were doing and what organisations were doing. So this reflected the finding of the studies that in these early days of the lockdown, there was more going on through individuals and local community networks than through organisations. the outcomes of the community capacity that was built were both personal and practical. So individuals talked about how they felt about being involved. Diarists said it gave them a sense of purpose and of being useful or of value and being productive. But there were also negative outcomes for individuals involved in the community response. And there was worry that, for example, the contact they were having with people who were at risk, and an element of burnout in the short term. There were also not the usual support mechanisms for volunteers involved in community activities. So new channels of communication and ways of working were being created, and the responses from the diarists showed that an important outcome of this community capacity was meeting the basic needs of residents for food and contact to maintain their social well-being, particularly those who were housebound. As this person said, a small meal, a chat and a smile can mean so much to someone. But the diary project was a short-term piece of work, so we're not able to report on the longer-term community capacity that was built and whether there was an ongoing impact. And there was certainly a hope expressed that the positives would be maintained when things got back to normal. So greater connectivity, offers of help and creative solutions. So just finally, in terms of the sharing the findings of the diary project, we've aimed to share the information in different ways so we can reach different audiences who are interested in different aspects of the project. And we know that the public advisors involved have also been sharing their experiences. In the journal articles, we're filling a gap in the academic research. So there hasn't been much qualitative research in the UK around residents' experiences and community responses, or in the diary methods. And providing advice, we've provided advice to other researchers who have inquired about the diary methodology. So showing how the use of diaries can be particularly beneficial in documenting lived accounts during times such as we've been living through. And we know, as I said before, advisors and the theme have been sharing their findings to inform other work. And these are just 3 examples. So I know through the public involvement, the public advisors have been talking about digital inclusion. And my colleague Joanna Goldthorpe here has joined the Mental Health and Community Post-COVID Research Development Network and is keen to share the findings with them. And the diary project's also been accepted to be part of the National Institute for Health's research website, be a part of research where people can find out about and contact health and social care research studies. So finally, I'd just like to note our thanks to the advisors who were involved in the studies and acknowledge the work of the whole EPIC team on the diary project and its outputs. And please get in touch if you'd like to know anything else about any aspect of this work. Thanks.
Thank you, Fiona. Now, for our final research presentation, we're going to hear about how housing developments can affect the health of residents and local communities. And Joanna Goldthorpe will be talking about the Belrig Garden Village.
So, hi everyone. I hope you can see my screen okay. Okay, so I'm going to talk, I'm Joanna Goldthorpe, I'm a research fellow in the EPIC theme, and I'm going to talk to you about a new piece of work that we're about to start in EPIC on the Belrig Garden Village development. The first study that we have planned will look at the potential for housing developments to affect the health of residents and local communities. And this research is so new, we haven't actually got started on it yet, but I'm going to talk to you about what we will be doing. So The development site for the Belridge Garden Village is centred right next to Lancaster University. So you can see on the map on the right, we have Lancaster University that's shaded in grey. And then to the left, we have the first phase, which the developers hope will commence in 2022. Then over further to the left is the final development area, which plans are in place for development to commence there in 2031. You can see from the map on the left that the area currently is all greenfield with a few farms. There's also a cycle track to the west and a canal to the south. So it's a pretty nice area for a housing development and potentially lucrative. So the background to the Belridge Garden Village is that it's an initiative that's been put in place by the Ministry for Housing, Community and Local Government, and it's part of their Garden Communities initiative. Garden villages are defined as distinct communities of between 1,500 to 10,000 homes, so from very small to pretty large. And developers who get involved with the Garden Communities Initiative also have access to infrastructure funding programmes across government, such as the new 2.3 billion housing infrastructure fund. So there are various pots of money that developers can apply for, and this shows, I guess, the government commitment to building these developments in terms of money as well as just rhetoric. The background to our involvement in the research is that Lancaster University was approached by Lancaster City Council and the consultants who were developing the master plan for Belridge, a company called Farrar Huxley. And they had two broad priorities for collaboration and research. So the two areas were environmental research, which is, for example, impact on soils and ecosystems, and what was articulated as social/community research. And this was, again, articulated as being around how many people earn a living here, jobs, social characteristics, deprivation, health indicators such as loneliness and other quality of life indicators. And eventually, the EPIC theme and Imagination Lancaster, which is another organisation that sits within Lancaster University, were invited to conduct the research on the social and communities element and contribute to the draft master plan, which was going to be produced by Farrar Huxley. Now, in reality, we actually had about 5 days to collaborate, have a chat and put forward our recommendations for the draft master plan, which were implemented probably in ways in which perhaps may not have that much impact, but anyway, we'll see how that all pans out at the moment. So out with the kind of Farrar Huxley boundaries or kind of proposals, Lancaster City Council are also keen to conduct other research. And this presents an opportunity to look in detail at the impact of new housing, of this particular new housing development on health. So the Health Foundation have recently produced a large report summarising the evidence around housing and health, which shows that there's a huge link between the impact of housing and physical and mental health. Also, housing has potential to either improve or exacerbate existing health inequalities. So there's elements such as the air quality in indoor and outdoor space, and also what indoor and outdoor space actually looks like. Tenure of housing, there's evidence to suggest that long-term tenancy agreements are health promoting. Issues such as overcrowding, quality and comfort, the communities that these housing developments generate or disturb, affordability, efficiency and safety of housing. And the infographic on the right summarises this research on how good quality housing can improve public health. There's also a cost benefit associated with good quality, affordable housing, and also the availability of rented housing with long-term tenancy agreements. An estimated £2 return for the Treasury on every £1 spent on housing. So that's there's a few pretty good reasons to look at the impact of housing on health in more detail. So the Bellrig development is still in the planning stages, and the piece of work that we are about to undertake focuses specifically on the community reaction to the proposals so far to develop this land for housing. So the objectives of this current piece of research that we're planning is to analyse posts on community Facebook pages and comments on local print and online media articles in relation to the development. So we want to find out what people's concerns are, perhaps that they haven't articulated as well or haven't been expressed through some of the planning, the involvement of communities in planning so far. So to look at sort of what's going on underground, if you like. And we want to use these findings to explore if and how these may have shaped the master plan and the content of the housing and environmental features of the Bellrig Garden Village as the development progresses through the various phases. We'd also like to inform future research. So for example, how we might use some of the findings from the social media posts to inform our qualitative interviews and potentially surveys with local communities and future residents, again, as the development phases progress. And this particular piece of work, again, around the social media, will start as soon as ethical approval is received, and the application went in yesterday, so hopefully in the next month or so. Longer term plans, and there are a number of possibilities for ARC North West Coast collaborations as the development commences through the development phases. So I'd be really interested to talk to anybody who's got an interest in housing and health to see how we can involve some of our other organisations across the North West Coast. So we'd like to continue our collaborations with Lancaster City Council and Imagination Lancaster, who have a specific interest in involving communities in architecture and development plans. So they have got an architectural background, and recruit public advisors from the local community, particularly those who are going to be affected by the Bellrig development, to develop the project further. Some ideas might be in the future for a mixed method study to explore the views of local communities around the perceived impact on health and inequalities. Also to identify some outcome measures that are meaningful to these communities, and the stakeholders that are involved that can be measured in future longitudinal research as the development progresses in time, and to compare the perceived impact with the actual impact of the development on health and health inequalities, and the health and overall quality of life on residents and also the nearby communities, particularly those who've been established and have been around for a long time, a number of years, across these phases of development. And there are also a number of possibilities for cross-art collaboration. The Garden Village and the Garden Towns, which form the Garden Communities Initiative, are nationwide. There's 17 in total. So you can see there's quite a few opportunities for national collaborations. You can see there are other coastal developments, particularly across the southwest and the southeast. So as our work in EPIC commences, I'd like to reach out to some of the other ARCs out with the Northwest Coast as well as internally. And I think there's a real opportunity here to influence housing policy. It's been a long time since we've had a really joined up piece of social housing and that takes into account health. And I think it's high time this area was looked at in more detail. So if anybody is interested in getting involved in some of this research, my email address is jgoldthorpe@lancaster.ac.uk. You could also get in touch with me via the EPIC inquiries line. and you can also post in chat if you're interested in collaborating. So thank you very much for listening to me, and I'm going to stop the share now.
Thank you, Joanna. So now I'm going to hand over to Annie, who is going to, I think, explain how you can reflect on today's presentations and what you've heard, and add your comments and thoughts on how it might link with the work that you're interested in as well. So Annie, can I pass to you?
Yeah, brilliant. Thank you. So I believe that a link will be posted into the chat in a minute, and that will be for a oh no, what's it called? A Jamboard. And we're inviting, as Emma said, any comments you've got on what you've heard. So it might be on what we've decided to present to you. And if you were interested in something else, hearing something else from us, it might be about the content. It might be why something's important, how that relates to the work you're doing or to your lives. So in the case of the Garden Village, I could say that relates very strongly to my life because I lived in one of the villages for a long time that's right next to the development, and I could reflect on those experiences. So it's really a chance for you to contribute your thoughts, and you could also ask us questions. And I believe that Koza is going to share her screen. And you're welcome to not just comment in the Jamboard. If there's something you want to just say, you can raise a hand and I can invite you to say that, or you can post in the chat. We're seeing the Jamboard now on Koza's screen, and there are a few of you in there.
There's a comment, if people can hear me, that Darren's posted in the chat, Joanna, specifically related to the Bale Rig project, around whether conversations have yet taken place around obviously access via public transport, etc., and also how that might correlate or not, as in the development with the quality of life in the surrounding areas, impacts on potential air pollution and air quality. Do you know if there's a conversation that's been had in already?
Yeah, I was just typing a response in the chat actually, but I'll answer you now. Yeah, the aim is for every house in Bale Rig to be within, I think it's 10 minutes from a bus stop. I know that the train station is quite a distance away, but they are looking at the buses and bus stops, and there's also going to be cycle lanes apparently planned. So we'll see how this pans out. I mean, this is something that was in the master plan, but I've recently found out that the master plan is a guide. So if anybody's interested in looking at that, if you just Google Bale Rig Garden Village and you can have a look at the master plan. But yeah, that's a guide, and it depends on whether Lancaster City Council take that up as part of their spatial planning, and also whether the developers decide to adhere to that. It depends how sort of stringent Lancaster City Council are in enforcing some of the master plan guidelines. So yeah, it has been discussed and there are plans, but whether that is what the development's going to look like in the end, we'll hopefully see through our research.
I'm wondering, Jo, if obviously, so where the Garden Village is a floodplain, and the villages around where it is have all flooded quite recently, quite catastrophically as well. And a lot of the resistance to the development came initially because of the floodplain. I wonder if there's been discussion about the trauma of that, of even suggesting building, and it came sort of the year of the flood, that, oh, we're also going to build here. And that's quite traumatic for people who've been through a flood.
That is an excellent point. And yeah, that is certainly something that I'll be looking out for now on social media. So thank you for bringing that to my attention, the potential impact on mental health.
Yeah.
Of this development. In terms of the actual work around the kind of more environmental features of flood prevention, LEC are doing that, Lancaster Environmental Centre. So that's a piece that they were getting involved in, and I know they wanted to make recommendations around that as part of the master plan. So hopefully, again, some of their recommendations will be taken into account as well.
Joe, there's a question on the Jamboard. Do you know whether the Garden Village Research Project relates to the wider plans around reorganising roads and transports in Lancaster?
I don't, other than this talk about the bus stops, the cycle lanes, and the pedestrian friendly aspects of the Belridge development itself. I'm not sure whether it fits into the wider plans for Lancaster, I'm afraid. But again, all these are great questions that I can incorporate into the research going forward.
Just thinking about the geography of the Garden Village. So it's just off the A6. So if people know Lancaster, they'll know the A6, which goes from the M6, and it goes straight through Lancaster and past the university on the way. It's actually the most polluted road, and the most polluted bits of the road are in Goldgate Village, which is just on the outskirts of the Garden Village. I think another fear is that it will just bring more cars into the village, and HGVs when they're building and things. I know there was talk about changing the motorway junction to around the university. I wonder if that, again, you need to think about or you don't need to, but it's an infrastructure question. If that had been considered, it would change how villagers felt about it, I think. We've got another question in the chat from Hilary. What other aspects of infrastructure have been considered, e.g. health, education and social care support?
I know that was brought up so in the lead up to the master plan, there was a few community meetings held, and I attended one of those. There was a few others that had gone on before Lancaster were approached to get involved in this. And it was brought up by residents, so they were very, very concerned about infrastructure. The schools are already swamped. Are they going to be building schools, doctors' surgeries, and places for older residents to live? So yeah, it's a good question. It's a good point that Paul has just put. Are there anybody from Lancaster City Council in the audience who could answer some of those questions? So they've certainly been considered, Hilary, to answer your question, yes. Again, it'll be interesting to see whether those considerations manifest in the planning.
Question from Alison, are there safe play spaces for children?
There are safe play spaces for children planned, yeah.
I wonder about the sort of, you're going to have this new fancy garden village, and then you're going to have Goldgate, which is a bit dilapidated. It's a bit sad. And I wonder about the sort of oxymoron of that. You've got this beautiful singing or dancing garden village that sits next to somewhere that hasn't had much investment at all. I wonder if that's been considered, in terms of mental health strain as well. Yeah. You can imagine that fueling frustration.
Yeah, absolutely. And that was one of Imagination Lancaster's proposals, was rather than thinking about generating new communities in Belrig, it was about offering or encouraging people from Goldgate and the surrounding areas to actually settle in the garden villages as well. So why build new communities when there's already communities out there? But in order to do that, the housing needs to be affordable, and there needs to be rented housing, so the children of the older residents of Goldgate can perhaps stay in the community. And that was one of our main recommendations, that we have affordable and from my point of view, particularly rented, with good quality tenancy and tenure kind of arrangements. And yeah, that was our main recommendation actually for the garden village. So for the master plan, sorry. So yeah, we'll see. And I've just seen that there is a comment on social prescribing, actually, Emma, because I just noticed it then. The Diaries project is a truly remarkable snapshot of an unprecedented period in modern times and an outstanding document of social history, which is an excellent comment.
Do we have anything else on the Jamboard, Koza, that's not related to Garden Village, however much we love talking about it? Koza? Okay. I'm not sure Koza can hear me.
Sorry, I was muted, Annie. I was trying to multitask and looking at the wrong screen.
You're doing a very good job.
I think there's just been some general comments around the green spaces presentation from Susan around the allotments and local authorities. And somebody from Mersey Care, I wasn't sure who the person was because the name didn't appear, but I think Lucy's dropped a message in the chat to offer connecting with you.
I think for me, although we've been talking about the Garden Village, what's quite interesting is that the things we're reflecting upon actually quite strongly relate to earlier presentations, which I think is it's a good sign for EPIC's work, that we're actually building upon the learning that we've got in other areas.
Yeah, definitely. And I think the community responses was such a key part of the diary project, such a key finding, that to go back to this notion of, rather than building new communities, build on existing communities, but in a slightly different location is really valid. It relates directly to that work.
Yeah.
There's a question from Neil. Am I still? Oh, I'm not unmuted still. There's a question from Neil saying, you've talked about Lancaster University and Lancaster City Council's role in social impact and health inequalities consequences of the Garden Village, but do you have any further information on the bioecological impact of the development, please?
I don't personally, but I know where you can find that information, because it's Lancaster Environment Centre who have been involved in the ecological impact. I can put you in touch with some of the people who are involved in that, or if you do a Google for the Bellrig, if you Google the Bellrig Garden Village, there's some elements of that in the master plan. I don't know how much of LEX, which is Lancaster Environmental Centre's recommendations, were taken up in the master plan, but there's certainly some pieces around it. And yeah, if you want me to put you in touch with those people, I can do. Just send me an email and I'll go through my emails and find out what their names were. Hope that's helpful.
Brilliant. On the topic of the diary project, obviously in that project we're talking about people going through a trauma, and as Hina just said, people being empowered, and you got the community response and people acted in a way that perhaps they didn't feel able to before, or they realized a capacity to act and affect change. And I think what COVID has shown is actually something that the communities around the Garden Village have experienced themselves because of the flooding. Big community action groups emerged out of that, just like they did from COVID. People brought anything that people needed to their house. We had a hub at the community centre. We had all the things that we've sort of had post-COVID, really, but a year before, 2 years before. So that's really interesting.
Yeah, and there's a comment, I think, to that effect in December about from Hina saying, I would say that the pandemic has shown us the importance of communities, and if we put resources in equipping them, empowering them, that would definitely help promote overall well-being.
Yeah, it's a really good point here. Thank you. So Koza's saying she didn't tell people, but I should have told people how to use the Jamboard, really. Koza, can you advise?
Yes, so on the left-hand side, you should see a number of icons. There's a pen, there's an arrow, and there's a square sign. If you hover over these, one's a sticky note, and if you click on that, it'll bring up a box and you can type in some text. So apologies for that.
Yeah, and I would say you can, after this is over, because I realise we're coming up to the end, you can comment then, and we'll look at it and make sure we take it into account.
Well, please feel free to post your final comments in the session. It's just coming up, it's just past 5 to 1. So I suggest we start to bring the session to a close so people can have a slightly longer break before they come back for the next bit of the ARCFEST. But yeah, so just thanks to everyone for coming along and all the presenters. And if there's any questions which haven't been answered, please feel free to email EPIC using the EPIC email address. Would somebody be able to post that in the chat, please? Or contact the members of the team directly who presented. So great, I think unless it's anything else from anyone, we'll bring the session to a close. So thank you.
Thank you very much.
Okay, thank you everybody, we are clear. Cool, thank you very much. We have lunch now until 1:30, and then thereafter we have our cross-cutting theme updates from Impact, Midas, and CHI. So please join us again at 1:30, and we'll kick off for those 3 theme sessions. Thank you.